Today I'm talking to Lauren Boyler, the men's soccer team's athletic trainer. She basically helps us when we get injured, I would say. Please, Lauren, explain what you're doing here.
I'm working with Matt Leonard, one of our men's soccer players. He had surgery on his lower legs. You can see the cuts right there. He had what's called compartment syndrome, and so we had to release the fascia underneath to give his muscle more room to expand. So we're doing soft tissue on it so that way it doesn't scar down and it keeps his tissue mobility nice and soft and supple.
That sounds very complicated.
And he loves me for it, see?
Yeah, of course. Of course. Would you say, during your time here at Marquette, is this one of the worst injuries you've seen? Or what would the worst injury be?
We've actually had many cases of this, for whatever the case may be. The worst injury I've ever seen was a hip dislocation for a football player. He went back to set and turned to look at one of his receivers, and somebody wrapped him around from behind and rotated his knee so much that his hip came out of the joint. That's the worst. That was when I was an undergrad, was probably the worst injury I've ever seen. I haven't had any broken legs with this team, but I've had a couple of broken legs in soccer. We get like our ACLs, PCLs. Compartment syndrome is very common, and a lot of knee injuries in general for the most part.
I see.
Yeah, that too.
Please tell us a little bit about yourself and what you're doing at Marquette.
I've been an athletic trainer at Marquette. I have 4 completed seasons, so this will be my 5th, going into my 5th year. I've been an athletic trainer for 7 years, and I did my undergraduate degree in sports medicine. And then I did my master's at the University of Louisville, which is another Big East school, in sport administration. I've known our head coaches and our head coach and our associate head coach for 9 years, working goalkeeping camps with them and soccer camps. And so when I graduated with my master's, they pushed to hire me on here. And I've been with men's soccer ever since. Since then, I've taken on men's and women's tennis and a couple of other rehabs with other athletes and things like that. So I'm a busy person.
I hear that. How much education is needed to do what you're doing? I mean, it sounds like you know a lot of things.
You need a minimum of 4 years, so you need an undergraduate degree, a bachelor's degree, and a national certification. But I also went and did my master's so that way I could gain some experience in the field before really getting out full-time and stuff like that. So it's a minimum of 4 years. I've done 6 years, and then I've been in the field ever since. So.
Sweet. Well, when you were like a kid, was this your dream growing up? You wanted to be an athletic trainer, or what did you want to be?
Well, I really always, from a young age on, I really wanted to go to medical school or something like that. But then I played field hockey, soccer, and basketball from the age probably 5 or 6 on through high school, and just really love sports and how medicine coincides with that. I like being on the fields. I'm very competitive, so I like being on the sidelines with the athletes, and just kind of really found in high school that that's more of what I wanted to do. So I applied to college knowing that that's what I wanted to do. I actually only applied to one college, the one that I wanted, and got in. And
were you certain you were going to get in?
Was I sure that I was going to get in? Well, I went for my admissions tour there as a junior in high school, and they asked me where I wanted to live, so I was pretty confident that I was going there.
Nice. If you could choose anywhere to work, where would that be? Do you like it here at Marquette, or would you like to work for a professional soccer team or something?
Well, when I first started doing all this, everyone joked that I'd be the trainer for the Green Bay Packers. Was the joke. No, I really like working in the college setting. Maybe someplace a little warmer.
Of course.
But I like working with athletes that are determined and people that we can mold and make to be better athletes. So as long as I can be with anybody like that who really wants to work hard with me, doesn't matter.
Sounds good. I know from my own experience that you spend an extreme amount of hours working. A regular week during the season, how many hours do you spend at work?
During true fall season, it's easily 60 to 80 hours a week. Especially during preseason, work 12 to 14-hour days. And during the year, I mean, with games and travel, it's a lot to work. You know, it slows down in the off season, but it's a lot of work during the season to keep everybody healthy and keep up with all of our team schedules.
Are you in pain, Matthew?
Yes, very much so.
How is this making him better? Like,
Basically, we're breaking up scar tissue and not allowing it to lock back down. So, and it helps keep his muscle nice and soft and flexible. So even though it doesn't feel good because he'd had surgery there before, it helps him.
okay. Is it worth it to spend so much time working, like 80 hours a week?
That's a good question. It doesn't leave for as much personal time, but I mean, everyone in athletic training will tell you you do it because you love it, not because you make a ton of money. You know, I find it rewarding working with athletes like this who I get to know for 4 to 5 years. You get to know them later in life. You know, to me, it's worth being there, like to get them through the hard things and stuff like that. Like that's what makes it worth it, is to be that support system and that center person for them. So, I mean, I guess it just depends like what you want in life. You know, and this is kind of it's my thing.
As long as you do your thing, you're fine, right?
Exactly.
And I heard that your own mom has like a special role with the team during the games. Can you please explain that role?
Yeah. Now, my mom lives nearby here, and obviously she's been, if you will, like a soccer parent her entire life. And so she comes down to all of our home games, and she's also a pretty good baker.
Yes.
So she likes to make treats for the guys for game days and stuff like that, and she enjoys coming down and watching us play because she obviously knows a lot about the guys through me and stuff like that. And she's kind of our own little team mascot in her own way. Yeah, I got you. I'll show you in a sec.
Oh, is that bleeding?
It's just like where the scab gets broken open. You're fine. It's not bleeding. It's just red. But yeah, so she's been a part of our program for the 5 years that I've been here, wouldn't you say?
Yes, very much.
And
so.
she makes really good banana bread.
Oh, fabulous. She actually brought me some in the hospital.
Sounds fantastic. I can't wait until the fall season then.
Yep.
Thank you, Lauren Boyler.
You're welcome. Enjoy.